Hello and welcome to Health Check. My name is Grace Mutiso. On this episode, we'll be discussing about mental health and specifically depression. We'll be answering a few questions regarding what is depression, what are the signs and the symptoms, how can I know I'm suffering from depression, where do I get help, and much more. We encourage you to continue engaging with us via our WhatsApp number. Our WhatsApp number is 0708 222 323. That is 0708 222 323. You can also get us live on Facebook and YouTube. Our handle is at Hop TV Kenya. Remember to share this link with a friend and a loved one so that we can benefit together. To help us dig deep into this topic about depression, allow me to invite Dr. Malaika Kamenju or Kamenju. She'll be helping me know which one. Is it Kamenju or Kamenju? She is a psychiatrist and passionate about mental health. So engage with us. Remember, our WhatsApp line, 0708 222 323. And you can also engage with us at Hop TV Kenya. As I said, my name is Grace Mutiso. Allow me to invite Daktari. Good evening, Daktari. How are you?
I'm great. Thank you for having me, Grace.
Yes.
Yes, so it is Kamenju.
Kamenju.
Kamenju, yes, NJU. I am Dr. Malaika Kamenju. I am a consultant psychiatrist in private practice. And yes, like you said, I do love what I do for a living. I love mental health. I love raising awareness about mental health and all things mental health. So I'm glad to be here today to demystify depression.
Yes.
It's a word that is commonly used everywhere. People say they had a bad day, it was raining, I'm depressed.
Yes.
Salary imechelewa kidogo,
I'm
depressed, you know. And also, in terms of mental health conditions, they broadly lump them as depression. If you ask somebody, what is the problem with your uncle, the depression.
Yes.
Then when you ask, how did the person present, they say, oh, alikuwa labda, ako tu peke yake, anajiongelesha, anajiisolate, anajiongelesha. So that would not be depression per se, but surprisingly, or I think lack of awareness, everyone just lumps the word depression with everything to do with mental health conditions.
Okay.
So I'm glad to be here today to demystify mental health, to demystify depression, and let the public be aware about depression and mental health in general.
Okay.
Yes.
And you're glad to have you. Allow me to begin by asking you this. What are some of the myths you've had around psychiatrists that you'd love to demystify today? Let's start there before we get into defining what depression is.
Okay, so one of the common myths I've heard about psychiatrists is when you see one, they give you medication. Hao unaochwa dawa. Watakuandikia dawa immediately, hata kusikiliza, it's straight away to the pad, give medication, which is quite and not true at all. To be a psychiatrist, you first had to go through undergraduate degree to be a doctor, a general doctor.
Yes.
And then further specialized for myself at Nairobi University. I'm a psychiatrist. So a psychiatrist, like myself, is a mental health expert, meaning my bread and butter is to assess, evaluate, diagnose, and then treat the mental health that I found for the patient.
Yes.
Yeah. And in the treatment, I can employ various treatment recommendations. So depending on the person's severity, if it's mild, I might refer them to a psychologist. If it's moderate to severe, I might need to give them medication, even as we include in the treatment plan a psychologist as well. So it's not just about giving meds all the time. And also one of the other myths I've come across is that our medications make you feel like a zombie. They make you feel drowsy. You can't work. They change your brain chemistry, you know, and people really are fearful of any meds to do with mental health, which is quite unfortunate because I think over the years, we've had very few mental health experts in the country. Sometimes someone would fall into the hands of a non-expert and end up with a lot of medications. But my goal as a psychiatrist is to make sure that my patients receive the right diagnosis, first of all, and then secondly, get evidence-based treatment. You know, that means the lowest level of medications, the least level of medications, at the lowest dose to produce the maximum therapeutic effect. You know, because that way you have less medications, that's less cost to the patient. There's less side effects for the patient, you know, and also because of the therapeutic effect, they're able to go back to work or to school or be the person that they were before the illness. So that is the goal that I have, and it's the goal that most of us have as psychiatrists, is to make sure our patients have that. Yeah? They know the diagnosis, they're on the right medication, the least number of medication, least number of tablets or injections, and also they are aware of their illness. So they know, this is my diagnosis, this is the cause of the illness. Like, I am prone to relapses, so what do I do to prevent the relapses? Because it's a journey. It's not a one-stop shop. So like pneumonia or malaria, where I give drugs for 4 days and then you're fine, or pneumonia for 7 days, or 10 days maximum, or 14 days. For mental health, in most cases, it's a long-term, not long-term like forever, but sometime, couple of months, depending on how recurrent it has been. In the first episode of any illness, you give it for a few months. If it recurs again, then you might need to give treatment for a longer period of time.
Yes.
That's just, So they have to be aware, both the patient and the family, that this is it's a journey that you're beginning together, and there will be ups and downs. Hopefully less downs than ups.
Yes.
Yeah. But it's a journey.
Okay.
A journey.
One of the myths I've had is for one to visit a psychiatrist, they need to be at their worst. Either they're being taken to Madare, or such kind of a facility. Is that true?
That's so unfortunate, because first of all, Madare is a I've worked in Madare for my training. That's where we all train if you go to University of Nairobi.
Yes.
And Madare sees all manner of patients, from the mild presentations to the severe ones, And so a psychiatrist does not have to see the severe case. Actually, the goal of any psychiatrist is to prevent it getting to that level, So as soon as you see symptoms, the same way you start experiencing fevers or headaches for physical illness, you will not wait. You will go immediately and get amoxil or get a malaria slide, a BS for malaria, or a full blood picture to know what the problem is. So in that way, you prevent it getting from just a pneumonia to meningitis, Same way, the sooner they're brought to a psychiatrist, the better the outcome in the long run.
Yes.
Because like any illness, if, for example, if someone has hypertension, the longer they stay untreated, the worse the possible outcome. Because, it's going to affect perhaps the kidneys, perhaps the heart, perhaps the brain. A stroke is also imminent. So the same way with mental health conditions, the sooner you manage it, better the outcome.
Okay.
As soon as you see any mild symptoms of your loved one, whether it's your child or your husband or your wife or your sibling, having a change of behavior from what they used to be before. Perhaps they're not sleeping anymore, they're not eating as much, they are isolating themselves, they don't take part in family events, that's when to intervene. Don't wait until it's too late, as in not too late, but it has progressed further to then bring them for evaluation.
Okay.
Always best to prevent rather than to cure. Same thing in mental health as well.
Okay. So what will be termed, how would you define depression?
Yeah.
What condition would that be for it to be clinically defined as depression? Okay.
So depression falls under an umbrella of conditions called mood disorders.
Yes.
And mood is the emotional state of being. You can be happy, you can be sad, you can be worried, you can be anxious. So for depression, the characteristic of depression is somebody who has persistent low mood, sadness that persists most of the day, throughout the day for at least 2 weeks. Yeah, and also they have lost interest in things that they used to like before. Someone who used to like going golfing, who used to like journaling or writing art or dancing or, things they used to enjoy. A mother who used to like cooking for her family no longer has that interest anymore. A father who used to be going for Saturday, I guess, boys things, watching football, no longer goes for that anymore. Someone used to enjoy their work, no longer goes to work as much as they used to. So the two things is persistent low mood, sadness or irritability, very quick to anger, especially in children.
Yes.
That's how they present. They'll be more irritable as before. And then anhedonia, which is lack of interest in things that they used to enjoy previously. That's the two main symptoms. Now, the other ones are sleep disturbances. So they're either sleeping too much or too little, Eat food, they're either eating too little or too much. And with that comes, if it's too much, weight gain over time. If it's not eating much, it's weight loss over time, yeah. Then there's fatigue throughout the day. Someone has slept the entire day, but still in the morning, 10, but in the morning they're feeling so tired, they're fatigued, they have no energy. Then they've lost, when they go to work, they have poor focus. If they're in school, poor focus, concentration. And even they're very indecisive about what to do. They're always, he, am I he?
Yeah.
They have feelings of worthlessness or guilt. This is now, the guilt is really exaggerated over past mistakes. Perhaps they did something in the past, a very small thing, but now when I beba sana, they're feeling like, why is me, why did I do this? Yet to be quite honest, knowing them, it haikuwa that much of a big deal. Then the other feature of depression would be now thoughts of suicide. They have reached hopelessness, so now they're thinking about the thoughts of suicide. Then goes to suicidal ideation without a plan. And then with time, with a plan. And then again, they may attempt suicide, and unfortunately, some will complete the suicide. Yeah, so there are those 9 symptoms of depression, of which, for you to say that you have depression, it's at least 5 of those would be now major depressive disorder.
Okay.
What we call now clinical depression. Yes, because all those things, for you to also have MDD.
What is MDD?
Major depressive disorder.
Okay.
Sorry. Yeah.
Yes.
You also have no longer able to function at work. You can't go to work. You can't go to school. You're just unable to function, to do your day-to-day things as normal. You're just either in bed the whole time, or you're just by yourself and just can't function. That's what we call clinical depression, or MDD, major depressive disorder.
So what I hear you say, Dr. It's progressive. It starts with a small thing, then if not attended to, it grows and grows.
It could, yes. Normally it starts slowly, yes.
Okay.
It's gradual build up to now, when it might have, you get to a point where you have now severe depression. Yes.
Okay. As you've mentioning, I think I observed you also mentioned some of the symptoms that we can look out for and be able to tell this person is suffering from depression. I'm interested to know, does that also apply to children? You've said mood swings, not mood swings, like irritability.
To anger.
So how can a mother or a father measure and say, this anger, what the term terrible too? To differentiate between these are terrible too, and this one for sure, I think my child is suffering from depression. How can you be able to tell, especially in children and in teens?
Okay. So generally for children and adolescents, they'll be much more irritable than usual. Teens, most of the teens have some sort of, not attitude, but sort of puberty, quick to anger. This is more than usual for a 13-year-old or a 14-year-old. For children, perhaps they'll be crying more, not playing as much as they used to, no longer playful, eating less, losing weight. Kids are supposed to grow. These are when you go for clinic, there's a weight that you should be. So they're no longer gaining weight as they should. They're not eating, or they're vomiting, or they're just lethargic all the time. They don't want to play with the children. They don't want to play with the other children, or even with the mother. They might have difficulty sleeping at night. Crying most of the time. So the hallmark for children most times is the crying and the lack of appetite and just losing weight and not being playful. And if they're in school, grades dropping for both small babies also. The ones who are in P1 and all those things. Also, high school, primary school, grades are dropping. They're no longer interested in their schoolwork, or if they're in any sports. For example, they used to play basketball or some hobby they used to do. They no longer have interest in those things. They're reserved. They don't talk a lot. Oh, they can also be bullies. The bullies in school. They're the ones who, because of the anger, they take it out on other children. So they're always bullying other children, and they're just not happy.
Okay.
Yeah.
Okay. So what are some of the things that causes one to experience depression in their life?
Yeah.
That's
actually, the causes are multifactorial, meaning more than one factor. You can't say it's this particular one, kitu moja. So it's a bunch of things that now come to the person who is vulnerable and makes them manifest depression. The first thing is genetic predisposition. So if your family history of depression, perhaps your mother has depression or your father has depression, or a close relative or a sibling, then that keeps you at risk. Not to cause, but you're at higher risk compared to someone who doesn't have his family history.
So it's sort of hereditary.
Exactly.
Okay.
Yes. And then another thing is what we call ACEs, the adverse childhood experiences. So these are experiences that occur early on in life, even as early as your mother being pregnant with you. So if a mother is exposed to, during pregnancy, a very physical violence on her, emotional violence, psychological violence, which is the same thing as emotional violence, sexual violence, or neglect, or the baby is perhaps not wanted, or she's on medication, or she's on treatment for substance or any mental illness. All those things go towards, when you're pregnant, when you're in the stomach or in the belly or in the uterus, you're developing.
Yeah.
So all those things happening on the mother affect your brain development as well, and those circuits that are involved in impulse control, stress regulation, mood regulation, all of those are impacted in that time. Then you're born. So then when you're born and then you're exposed to a home that is perhaps having domestic violence, either on you as well, or your parents are always fighting, or there's physical abuse in the home, emotional abuse, psychological abuse, either to you or just in the environment, or you have one of your parents, you lose a parent either through divorce or separation or death. All these things, again, because you're still developing from the age of 0, or rather from birth until the age of 17, you're still developing. Your brain is still, I think it's still 25 years old, your brain is still developing. So if those things occur during that time, they affect your brain development in the areas that control mood, control stress regulation, and also control impulses. And all these now make you vulnerable to having a mental illness, including depression. Yeah? Another cause or another risk factor would be major life stresses.
Yes.
So this can be a loss. A loss can be a loss of a partner, a life partner, perhaps a loss of a job that you cared for, loss of finances, loss of a loved one, like a parent, or job transitions. All those things, any change can make you vulnerable, especially if it's unexpected, not planned for. It can make you vulnerable to getting depression, or any other mental illness.
And from practice, these causes varying maybe per gender. Like you'll see these causes more, or these symptoms more in women, and then you'll see these symptoms and causes more in men.
Yeah. So generally, from research, women are twice as likely than men to have depression.
Really?
Yes.
Why is that?
That's also because of we have hormonal changes most of our life. Yeah. Estrogen, progesterone, all those things, all those hormones play a role in also our emotional regulation. Yeah. So that just make us vulnerable to having postpartum depression. Actually, depression in pregnancy.
Yes.
Postpartum depression. Yeah. And also when menopause comes, again during menopause. So around the time of pregnancy, postpartum, and menopause, we are more vulnerable then compared to men, because men don't have those experiences for them. And also, women also, how they're more sensitive to stress than men, so that also makes them vulnerable to getting depression. And then there's the periods, which also come with normal hormone fluctuations that also can predispose you to getting depression during those times. What we call the PMDD, the PMS, which is now PMDD, which is more severe than PMS.
What's the full?
So PMS is premenstrual syndrome.
Okay.
And the PMDD is premenstrual dysphoric disorder. So this is a more severe form of PMS. So you're more irritable, the mood is very, very low. You are feeling hopeless. You're probably sleeping less or more. You're probably eating less or more. Same thing as depression, just that it's around the time of your period.
Yes.
Yeah? And then you're more irritable, even to the point of being suicidal around your period because of how your brain reacts to the normal hormone fluctuation. So the hormones are fine.
Yes.
But just the brain reaction to that is the problem. Yeah, and those who are vulnerable to getting it. Also, for men also don't really seek help. They have poor health-seeking behaviors compared to women. Any place you go, whether it's Kenyatta or any physical illness hospital, there are more women there than there are men.
Yes.
If there's a man there, amepelekwa na bibi yake, mama yake,
yes.
sister yake.
Forced, actually.
Exactly. As in umevurutana, mpaka sasa to hospitali.
Yes.
And also sometimes men will mask their depression with substance use. So they end up getting a diagnosis of substance use as opposed to depression because of how they present. They may be more irritable, more violent, All those can be signs of a man who has possible depression. Yeah. There's also a chance of them being misdiagnosed as having something else as opposed to depression because of how they present.
And you know, when we began, you mentioned we loosely use the word depression.
Yeah.
On our day-to-day activity. There is traffic jam, I'm depressed. There is jam.
Yeah.
There is this, I'm depressed. You know, name it.
Everything.
Is that healthy to be doing that? You know?
I don't think there's really much of a problem as long as you understand that you're actually not depressed. Because for you to be depressed, it must be persistent, as in persistent low mood or lack of interest in things for at least 2 weeks. And that in that 2 weeks, it's almost every day and most of the time, most of the day, you know, consistently for 2 weeks or longer. But sasa hii ya jam, mtu sasa jam ikifunguka, you're now back to happiness. You know? Or salary ikiingia, mshahara ikiingia, now you're back to happiness.
Yeah.
You know, that cannot be depression, only if it persists. And then also the other things, you're not eating, you're not sleeping, you're fatigued all the time. So that must be a whole cluster of symptoms to say that this is depression.
Okay. Sawa. And if you're joining us right now, karibu sana. We're talking about handling depression. And if you have any question, engage with us on our WhatsApp line at the bottom of your screen. We're also live at Hope TV Kenya on Facebook and YouTube. We look forward to engaging with you. Our guest today is Dr. Malaika Kamenju, a psychiatrist, joining us to help us with this topic for today. So do you have stages of depression? And if they're there, what are they? You can help us define them.
I wouldn't say there are stages of depression. It's more, we have a manual that the whole world uses in psychiatry to classify conditions, so to make our diagnosis. So whether I'm in China, whether I'm in Tanzania, whether I'm inside Burundi somewhere, it's the same. Depression is the same all over, you know? So it's more of severity. So there's mild depression, moderate, and then there's the severe one. So mild is you have less symptoms, you're functional. Moderate is you have more symptoms than mild, but maybe you're able to function. Then severe is when now you have a lot of symptoms, perhaps you're suicidal and you're unable to function, do your daily activities as a mom, as a doctor, as a whoever. That's now how we classify mild, moderate to severe. There's no stages.
Okay.
Yeah.
And could you help differentiate? So what are the things that comprises for you to define this as mild, for you to define this as moderate or severe?
So we have the 9 symptoms that I talked about. So low mood or irritability, anhedonia, which is lack of interest in things that you used to enjoy doing. There's eating less or more, sleeping less or more. There's fatigue. There's loss of focus at work and being indecisive. There's being restless or just having slow movements in how you're doing your things. And then there's feelings of worthlessness, hopelessness, and then low self-esteem. And then the next one now is the suicidal thoughts. So the more symptoms you have, the more severe it is of the 9, you know? If you have 2, 3 symptoms, that's mild. If you have less than 5 or 6, that's now moderate. And above 6 and more, that's now severe depression.
Okay.
It's based on that classification by it's called the DSM-5 that we use to diagnose persons with either depression, anxiety, and whatnot.
Okay. I'd love us to take a short break. When we come back, would love to hear. So I've been directed to come and see Dr. Malaika. So how is that the process of, diagnosing, you'll take me through the journey from the time I enter your office. So what happens to be able to diagnose that this client has depression?
Let's do that.
Yes. Allow us to have this quick break right here on Health Check. My name is Grace Mutiso. I'm hosting Dr. Malaika, a psychiatrist. We're talking about depression. When we come back, we'll be getting deeper into our topic. Keep it right here.
In order to keep hope alive in the airwaves, Hope Media has a couple of initiatives. Friends of Hope. Friends of Hope is you and I forming a team of well-wishers and volunteers who give in cash and kind to support in spreading the gospel at Hope Media. Currently, Hope Media is running a campaign under Friends of Hope dubbed 100 for 1. Through the campaign, Hope Media is asking Hope FM and Hope TV listeners and viewers to give just 100 shillings in order to reach one more soul with the message of hope and the gospel. Engage with us on our social media platforms at Hope FM Live and at Hope TV Kenya. Kuwa rafiki mso leo.
Welcome back to Health Check. If you're joining us right now, karibu sana. We are talking about depression and how to handle it. And I'm hosting Dr. Malaika Kamenju, our guest today. She is a psychiatrist. Dr. Before we went on break, we promised viewers that when we come back, we'll be talking. So I've brought myself. I think I'm not feeling well. I need to see Dr. Malaika. So I'm in your office. Take us through the process. What happens in the diagnosis?
Okay. So as a mental health expert, a psychiatrist, like I said, my training is to assess, evaluate, then diagnose, and then come to a treatment plan for you, with you in the plan.
Yes.
So we do what we call history taking. That involves me asking you questions about yourself, about what you're feeling, how long you've been feeling it, how it's affected your day-to-day activities, whether it's your work life, even your sex life, because all these things impact on your life in general. And then we also take a medical history, because sometimes you may present with a mental health condition, but actually it's because of a physical illness that is causing you to present this way.
Yes.
So some of them could be thyroid hormone irregularities, immune diseases also can present with mental health conditions. So we need to understand where is this coming from? Is there any physical illness that is linked to this current mental presentation? Also drugs. What drugs are you on? Are you on any medication for anything? Because there's some drugs that also can induce what's it called? Depression. Yeah?
Yes.
So drugs for hypertension, but not for hypertension. Drugs that are used for antivirals for HIV also can induce depression. At the same time, we need also to understand if you've been seen by another doctor for anything else in the past. Do you have any diagnosis? Like I said, hypertension, diabetes, because all those things again can impact your mental health.
Yes.
You know, can cause you any chronic illness can predispose you to getting depression because of how it is very, very not tiresome, but the clinic reviews, the medication every day, the BPs going up and down also can induce this condition. Are you on any creams? Because there's creams that women use, for example, creams for skin bleaching, that also can induce hormonal changes leading to depression as well. So that's very important for us to know if you have any diagnosis for a physical illness. Because even if I'm to give you medication, I must know what drugs you're already on to see if they're going to interact well with my medication. That's very important for me to know. So it's a long history that I have to take. So the medical history, the drugs you've been on, and then also the psychiatric history. Is this your first time coming with this presentation? Are there others in the past? What happened this particular time? Were you undergoing some stress, pregnancy perhaps, postpartum, loss of work? Have you lost a loved one? All those things help me understand how to go from there. Substance use history. Do you take alcohol? How frequent is that alcohol take? Do you feel the symptoms after the drugs, after you've taken the alcohol, or even before the alcohol, you're still feeling low? So I can know if it's alcohol that is inducing the depression, or it's just depression throughout without the alcohol. Also, weed, bang, is very popular these days.
Yeah.
That can also induce depression and anxiety as well. So I must know exactly what drugs you're taking to know where to go from there. Family history. Are you the only one with this particular presentation? Do you know any relative, a mother, a father, your uncle, your cousin, who's had a similar presentation or any other mental illness?
Yes.
Surprisingly, when you ask that question, people always say no. Akuna, then you ask, is there anybody in your family who has alcohol, that drinks alcohol excessively? Then you're like, kwani pia hiyo ni ugonjwa? And you're like, yes, because I want to understand if your uncle somewhere in the village drinks alcohol excessively, cannot work, perhaps he also has the same problem that you have, just that he's using alcohol to mask it. So yes, public alcohol excessive use, addiction is a mental illness. Another thing I want to know is again, yes, have they had any diagnosis? Have been any psychiatric medication in the past? So I can know if it worked for them, then perhaps I give the same treatment now, because whatever has worked in the past likely will also work in the future.
Yes.
So other than that, we also will do some tests, because again, like I said, the thyroid hormone also can have issues. If it's irregular, then also you must do tests, because if you also have low blood count, low HB, it can make you be fatigued, have no energy, perhaps be just lethargic all the time, not eat well. So also we must do a blood screen for thyroid check, for a full blood picture to understand,
Yes.
To see how your kidneys are, how the liver is. So very important for us to get to see where we're starting from, the baseline for you. So that's the history part. But also we like talking to relatives as well. You know, if you have a wife, if you have a mother or father, if you're a child or adolescent and you have a parent who lives with you, or a partner or a roommate who has known you perhaps for a long time, their input is very important because they have seen you perhaps from when you're healthy to now when you've slowly gone down this path.
Yes.
They can tell us perhaps what they think happened to trigger this, since they're already there, or what other things that you have not said that they have observed about your behaviors. It's a very long process, the assessing and the evaluating, that involves the patient himself, the relatives, at most cases, or a friend or a colleague who has known the patient for a long time.
Yes.
To come to now to understand this is the patient's presentation for this long, they have this medical condition, they have this physical condition, they're on these medications, for us now to know how to move forward. That's the assessing part. And then once we've gotten all that, now we're coming to a diagnosis, which, to be quite honest, sometimes it's not very easy to reach on the first day.
Yeah.
But require repeated visits to know what we're really dealing with, or even an inpatient admission to understand, to observe for ourselves and see, anyway, we've seen this at night, they're better, in the morning they're worse, you know, to observe over a period of time, not too long, 2-3 days, to see how they are behaving also for ourselves to come to a diagnosis. Once we have come to a diagnosis, then comes the treatment plan, yes, which must be collaborative also with the relative, because they have to understand their relatives' condition. They must understand it very well to know that perhaps it's a long-term thing. It requires medication. It requires psychological review as well, and not kuchoka or sichoke.
Yeah.
You know, si malaria, si pneumonia, so si kitu ya siku 7 ama siku 10. There are ups and downs, and this person needs your support, but also need your understanding and your understanding and compassion. Yeah, the same way if somebody had diabetes, for example, or hypertension, and they required to be admitted because sugars were too high or sugars were not too low or whatever, BPs were too high, you'd never see someone saying, you know, they would always take them for review after review after review. But for some reason, for mental health conditions, they tend to assume that anajifanya, you know, whereas you just be happy. You know, it's just be positive. You know, uko na bibi hata, uko na watoto, uko na kazi, unafikiria nini. You know, so simple kama to be positive or affirmation. This is much more bigger than that. So again, for the treatment, like I said, as a psychiatrist, my goal is always to get a diagnosis, give the least amount of drugs I can give at the lowest dose, to get the maximum therapeutic effect for the patient.
Yes.
And also, I layer kwamba, we will get this medication, but perhaps with time we'll review the medication and see, is it too low, is it too high, should we increase over time? It's a journey. Reviews initially, you know, till we get to the best dose that works for the patient, that allows him or her to be able to go back to themselves as in full symptom resolution.
Yes.
And be able to go back to society and do school, do work, and whatever that is. Yes.
And can somebody totally heal from depression completely?
Yes. So somebody can have just one episode, and that's that.
Yeah.
Maybe something happened, and then they go into depression, and then they get medication, and they get better. You know, or even they can even just be at home for 3 months, and then they get better without any medication. But the nature of illnesses are, whether it's in physical or mental illness, as long as you've had one episode, you're always prone to another one. You're always vulnerable to a relapse at some point. If, for example, you have a miscarriage, you're also very at high risk of getting another miscarriage with the next pregnancy because you have the previous history of a miscarriage.
Yes.
So similarly with mental illness, if you had it one time, you're more likely to have it again in the future if something should happen. Yeah, so it is, and when you see it for the first time, it's hard to know if it's going to be the first time or there'll be recurrent episodes. There's no way of knowing that this one need to peke yake at hata recur. So time will tell us if it's going to be a one-time thing or it's going to recur.
Okay.
Yeah.
What are some of the complications that one can encounter if depression is not dealt with?
Yeah. So worldwide, it's the commonest condition that causes people to miss work or miss school. depression. It's the highest, it's the commonest illness that leads to people not going to work or not going to school for a long time. Yeah. So of course, like we say, there's also symptom of suicide, thoughts, ideation, attempts, and completion. So that's one of the main complications is the risk of suicide is very high. Other than that, the other risk could be now somebody who is not eating well, who is not taking care of themselves, they're always in bed. If they have any physical illness, they perhaps won't take care of themselves in that regard. Like if they have diabetes, hypertension, they will not take their meds as usual, they're not eating well. So that illness that they have can also lead to complications for them because of that, not taking care of themselves, not sleeping well, not eating a balanced diet, not exercising. All those things can lead to having an issue, physical issue because of the mental issue.
Yes.
You understand?
Yes.
At the same time, of course, having depression, so you're low, you keep to yourself, you may lose social connections over time. You may lose work, you may lose school, drop out of school because of now you're always in bed, you can't focus, you know. So there are social implications to that, yeah. Even financial, if you lose work, then you lose perhaps your insurance cover, then you can't get access to medication or healthcare services. You see, that again leads to more problems, yeah. But of course, the biggest one will be the suicide risk and the attempt and completion. Though the other things as well that also can come along with time if you don't treat the depression as soon as possible.
Yes.
Yeah.
You know, we're talking, Dr. Malaika, and somebody could be watching us and saying, all these symptoms you're talking about, I identify a few of them. And they could be alone in a house, just seated watching us or following us online.
Yeah.
What would you tell them? I'd just love you to look into the camera and speak to them. That's one category of person. The other one is maybe a parent and saying, I have observed this in my child. I've observed this in my teenager. Where is their starting point?
Yeah.
Yeah.
So the first thing that you'll do is what we call self-care. Do whatever it is that you do to make you feel good. Others is taking a cup of tea. That's me. Taking tea all the time. So that's what gives you joy. Do that. If it's swimming, if it's hiking, if it's jogging, if it's whatever thing that makes you feel good about yourself, do that first. Yeah. And then see how you feel afterwards. If it's still persisting, talk to a loved one, a friend, a sister, a mother, a colleague at work, you know, and see how they can help you, like maybe share mawazo and all that. If it still persists, come and see a psychiatrist.
Yes.
Come and see me, you know, because then we can figure out why is it that things you're doing to enjoy yourself as usual, as if as you work, umongena beshte yako, bado is work. So now it's time to see a professional to see now how to go from there.
Yes.
Yeah. That's the first scenario. Second one was the son.
Second one, yeah, a parent has observed that in either their son, their daughter, their child, their toddler.
Yeah.
Where's the starting point for them?
So that question is very good, because if somebody observed their person with heart failure, you know, they are having a stroke, like they're numb on one side, they can't see on one side. They won't say nikaende kwanza nione, utaenda kwanza. You know, they will hurriedly take him to a hospital for treatment or for screening or whatever it is. If someone has fevers, your baby has fevers in the house, usiku hajalala, ni kulia to the whole night, ametapika, hana appetite, hajakula, utakane useme, let me just see how it's going to go for a few more days.
No.
You know, so same thing with mental illness. Don't stay with the person in the house. You know, just observing and seeing. Change behavior. Siku hizi haongei sana. Siku hizi hakuli. Siku hizi ako tu analala all the time. Hana time na friends wake. Ana hasira kila saa, nakasirika, analipuka kila saa. Take them to be seen by a psychiatrist. Yeah, that's the best thing, so that we can see. Again, it's a teenager, because most mental health conditions begin actually during teenage life. Around age 14 is when most times they begin. And then at most cases, they go untreated and undiagnosed. You know, so this child has this illness at that age, and later high school, whatever, perhaps the grades keep dropping, you know, they drop out of school. And then because no one noticed that he was going through this until later on, maybe he's in his 20s, perhaps he's gotten into drugs as a way to self-medicate himself. And then now it's now more bigger than it should have been at 14.
Yes.
So always, like any physical illness, you would not come and mtoto kwa nyumba akilia. Same thing, a child changing behavior, your spouse now no longer wants to talk to you, haendi kazini tena, she's very sad and moody all the time, not sleeping well, twende hospitali.
Yes.
Come see a psychiatrist.
Okay.
Yeah.
So two things. One, let's come to the work environment. How should organizations support a team member or a staff member who has mental health issues? It could be depression or maybe along the spectrum. How should they support them?
Yeah. So first, it's a good question, yeah, because many of us go to work, spend most of our day at work.
Yes.
And work can contribute to a mental health illness, also can be the source of the mental health problem. So it's first of all to have an open door policy where people can discuss about their mental health issues. A place where they have people come and raise awareness about mental health issues, so that the stigma isn't at the workplace. Because people are afraid to speak because they're afraid, if I tell my boss niko na hii shida, atanifuta kazi. Even when they're applying for work, they don't disclose. When they're hired, they don't disclose. When they are working, still they don't disclose, because they are afraid that if my boss knows, nimeenda.
Yes.
So having an atmosphere where people are free to talk about their conditions, if they have any, where the organization allows time off work. Because because somebody is physically okay, you say, why do you want time off? As in, why? When you're gonna fracture, as in, because they don't think because you look okay,
yes,
then you must be working. They don't understand that just because it's not visible, it's not there.
Yes.
So
yeah.
It's understanding that people have these things. It's out here. We have people struggling with mental health conditions. As an office, we need to be aware of it, to support our colleagues by not being judgmental, allowing them to talk if they want to, allowing them time off work to go for reviews, clinic reviews. Because many times people tell you, siwezi kuja, as in maybe weekend, because siwezi patiwa time off.
Yeah.
Hata nikipatiwa time off saizi, I can't ask again for another one in 2 weeks. You end up spreading apart the reviews, yet in the meantime, he's anaumia.
Yes.
Yeah. And even then, even at work now, he's no longer as he used to be, not as productive anymore. So we have what is called presentism, where somebody is there at work, yes, physically, but they're very, very low productivity because of this. So yes, they're there. So kuna absenteeism at work where they don't show kabisa. Then there's people coming, yes, but they barely produce what they're supposed to do. They're highly stressed about it. And then, of course, they can't speak to people about it.
Yes.
Yeah. So allowing a place where there's no stigma about mental health, people can talk about it, allowing them time off,
yes,
go and get help, or even time off to just be at home, sick leave. The same way you give someone sick leave because if they have malaria for a week or for 4 days, same thing should be given to somebody with a mental health condition, as in time off to go and see their doctor, go for reviews, and just stay at home and recuperate.
Yes.
Yeah.
Okay. And you mentioned about stigma, and a question comes to mind. What are some of the things we do, knowing or unknowing, that somebody having a mental health condition would say, I've been stigmatized here?
Yeah. It's being told things like I said, depression. Sasa kwa nini, as in, why? So uko na bibi, uko na, as in, think just because someone has a wife, has a good job, is a CEO, gives money all the time, haizi kuwa mgonjwa. As in, what do you mean depression? As in, asiana katupo, they look okay, they are going to work. What do you mean depression? So someone is afraid because they're the pillar of the family, for example. They're the ones who provide family finances. They're the ones who are top in church, the pastors in church, or the choir leaders in church. How do you say now you have depression? They'll just tell you, let's go and sing a bit, you'll feel better, or read the Bible, or even as you're going through the same thing, economy ni ngumu for everybody. Sasa unaumia aje, nata uko na kazi, or just, just walk it out, just itapita, it's just life inakuanga tu hivyo, so such things that minimize, invalidate someone's feelings, so they're afraid to go and get seen, and then be seen that as if they're weak, because for men, they'll be like, how do you, as in depression, come to kunywa pombe kiasi hapa, usikie raha, but so that's superficial, see evil, it's not that superficial that you can just say, okay, now I'm happy, I was sad, now I'm happy, let me drink kidogo, I'll be happy, it might work that time when you're drinking, you forget, perhaps it makes you, because alcohol also makes you feel some type of way, but once the alcohol has worn off, you go back to where you were,
Yeah.
Yeah, so such things as Hakuna kitu kama depression. We're all depressed anyway. Economy ni mbaya for everybody, you know. Uko na bibi, uko na watoto, uko na kazi. Uko na pesa. Shida ni nini sasa wewe? Mimi kwa tuna pesa but I'm here surviving. Wewe uko na pesa kwenu, and then so that makes people afraid to go because they're like enyewe. You know, I have money, I have a wife, I have a good car, I have a good job. Why am I weak? You know, is it me? Is it me who's just weak? And then they don't come.
Yes.
You know, the next thing you hear, perhaps they've struggled for a while, then something has happened. Yeah.
Okay. One more. I think there was a season I had because of generational gap. I'm sure you're dealing with, you know, both old and young for those who visit your clinic. And one young person said, my parents believe depression is not there.
Yeah.
Depression is demonic.
Yeah.
That one is for people who either are walking in the streets and they don't have clothes, you know, or they're just shabby. Could you speak into a generation that has that as a perception? So that if a child comes and tells you, Dad or Mom, I'm depressed.
So the funny thing is, a lot of young people come actually without the parents' knowledge that they have come for treatment. Yeah, even teenagers come, you know, and they say, my mom will never understand. She just tell me I'm just lazy. You know, I just don't want to do my schoolwork.
Or I'm pretending.
So that's the highest one. I'm pretending.
Yeah.
So they come, they seek treatment, and they never tell their parents about it. You know, because like you said, most parents will say, "Why are you depressed?" As an easy one, mom will just pray about it and all that, and itakuwa tu sawa, which is true. You know, even in our treatment model, it's the biopsychosocial spiritual.
What's that?
So bio means biological.
Yes.
That's we give, if there's need for medication, we give medication if need be. Psychosocial now is when, so psychological is when now we call a psychologist to come and give us like behavioral training techniques, how to cope with stress and those things. Social means we involve the family.
Yes.
The support system. Because now once they leave your office, now they're with the society. They're with their father, mother, sisters, wife, and everything. So they also must be roped in to understand, to be educated. So you must take time to educate this mother, this father about the child's illness. That is very important. Otherwise, without their support, we won't get too far. You know, so they must understand, isi kujifanya, hako too lazy. This is an issue with the body because of these chemicals so far in the brain and all that are making her or him be this way. So what you can do is encourage her to take her medication, come for reviews, also for you to understand that it perhaps may take a few months or weeks before she gets better, but she will get better.
Yes.
Yeah. And the last one now is the spiritual. So I would never tell somebody, you know, who wants to go and see their pastor, who wants to go and see their sheikh, not to go. For us, for me personally as a psychiatrist, I would incorporate that. You go for that if superpower helps you, because most people believe in God or a superpower that helps them or they are in need. So you believe in that. Pray to that maker, even as you incorporate the biological treatments, psychological treatments, the social treatments into this whole thing, because it's a more of a holistic approach in managing a condition. Yeah. So for the parents, it's education, educate to understand the illness. Yes. Give them the symptoms, give them brochures, let them understand, you know, things from other countries so they can see to who you are, Kenya too. It occurs quite commonly, and it can occur even to your son.
Okay. I believe older generation, we've had that and will be able to support our children when they come to us and they have that condition. So where should one get emergency help in case they have suicidal thoughts? Yeah. Where should they run to get help?
So the first thing is suicidal thoughts for us is an emergency. So what does one do if they're alone? Go find someone, you know, just go to the neighbor's house, or call a friend to come, or you go to see a friend, and then go to a public place, because you're unlikely to do it in a public place, you know. And also when you have someone around you, you're also not likely to do it as well. Then from there, go to see a mental health expert, like a psychiatrist, you know. That's really the steps. Leave your house, hostel, or room or office room you're in, go to the next room, work with a colleague, mwambie, I'm feeling like this. And then once you're in the presence of other people, you're unlikely to do it, and then go now and see a doctor, psychiatrist. Yeah.
And do they have the will to do that?
Do they have the will?
Yeah. I'm just imagining you're the psychiatrist here, a patient, like those who come and say, I've attempted suicide.
Yeah.
Yeah. At that point, you're giving first aid, like talk a hapa, go to the next room, or call a friend, tell a friend, this is what's happening, come now. At that point when the patient is having those thoughts, do they even think of that?
Of calling?
Of calling for help.
So that's what we would hope, that there will be at a point where they're able to think of going to the next room, leaving whatever room they're in, to go to the next room where there's someone, anybody, even if it is just perhaps someone who's cleaning the next room, or your nanny, or the shamba boy, anybody really is going to be a safe place, even as you now wait to go to see a doctor. Because the longer you're by yourself, the more the thoughts get intense, and then perhaps you go and start planning, and then the attempt.
Okay.
Yeah.
I've received a question here, somebody asking about those who hurt themselves, are those people going through depression, either cutting themselves, or doing harmful, just hurting their body. Are those people depressed, or it's a different condition?
So that can be a way out of depression for people, cutting themselves either on the wrists, in the inner arm, the abdomen, the thighs, as a way. Someone who is struggling with psychological pain, the pain can be so intense that they now feel like they need to release it by cutting. So once they see the blood, they feel some relief. If you're watching, you should see a psychiatrist. Yes. Tell your parent, tell your friend. Most don't tell, actually. Most parents find out now in the room that she's been cutting all this time. They never even knew. Or they'll just see marks and just assume that they're just like tattoos. They never think. So they eventually get told at the doctor's office that I've been doing this because of this, and I feel this way. So they're always in shock. They never know. Yeah. So most times people will hide it from their friends, because they go in their room, they close the door, and they do it to feel relief.
Okay. Yeah. Why is it important to have such kind of conversations? Not only in a TV station like Cop TV, in churches, in places of work, any other place. Just emphasis on the importance of that. Talking about mental health.
Yes. Because I think the WHO said in every hospital waiting room, 1 in 4 have a mental illness. And then I think in general public, I think 1 in 5 has a mental illness. So it's around us. Almost everyone is struggling with some form of mental health condition. Perhaps others have mild, others more severe, but it's with us. It's within us. It's in our churches. People come to church to seek spiritual help for psychological pain, and sometimes they seek it for such a long time in the churches, and they do not come to see a doctor about it, of which, of course, we are all for spiritual guidance, but incorporating medicine or science is the way to go. Incorporating science and spiritual beliefs is the way to go. So it is around us, it is in the churches, it is at our workplace. Nowadays, the world is so high on productivity, being productive, as in profit to the extent where people are really going through burnout. They're scared of losing their jobs. There's so much people losing their jobs because of redundancy. There's this machines taking over people's work. There's AI now, so why do they even need you anymore? People are always scared of being let go from their jobs, from their relationships, from their marriage. So there's a lot of stress in the world right now, and social media also helps in getting more stress, because you're seeing people who are living good lives, or living the life that you thought you're going to have, na hauna. So you're seeing this, you're seeing your friend, your colleague having such a nice life, yet mshahara ni hiyo moja. So you're so stressed about it. You want to take your kids to the best school, but pesa ndio hivyo, So so it's all around us. We must talk about it. We cannot let stigma win. Also, as mental health experts, we need to make the public know that we are able to treat them and give them the best quality of care with the least amount of medications, the lowest doses. So as long as you inform them, mapema sana, and then you discuss, because this can do this as a side effect, but then we will work with you slowly and see how it works with your body. If it's too much, we can give something else to counteract the effects, side effects, or we can stop it or reduce it. It's no one knows what will work for you. I can't tell. I know it is recommended for your illness, so I'll give you that one.
Yes.
Then I'll see how your body or how your symptoms react to the medication. If there's no reaction after some time, I should change it to something else. Same way I'll give you amoxil for cough, but haituli. Then I say, okay, let me add for you amoxiclav.
Yes.
And then inatulia kiasi, but not yet. Then I say, let me add for you erythromycin. So they all have different bacteria that they're targeting. Here kwanza it was this, idea. Ilikuwa ni hivi, more protection, more cover. Ingine ni upande huu mwingine, you see? So the same cough, but different ways of handling it.
Yes.
Then you come and see me, and you see me, I'm on cefuroxime, another antibiotic. You're like, mbona mimi nilipea hii, ulipewa hii? Ama wangu wajui, But it's just, we have many drugs, a lot of them, and what works for you may not work for me.
Okay.
So you have to make your patient very aware that it's a journey. Si kitu ya siku moja.
Okay.
Yes.
Excellent. We have to call it a day here. Can you imagine, Daktari? But we can't do that without letting our viewers know in case they need to get in touch with you. Where do they find you?
Oh, great.
Yeah.
So I am at the Tranquil Med Center in Langata North Road. Also, I'm on social media, Instagram, Dr. Malaika Kamenju, Instagram, X, the same, Facebook, Kenyan Psychiatrist. Yes, very active on Instagram, by the way. Again, it's Dr. Malaika _Kamenju on Instagram, Kenyan Psychiatrist, and also Tranquil Med Center. I'm there all day.
Okay. A number they can call maybe for office?
Yes. Number is 0787 127 614. Again, office number is 0787 127 614. And I'm in Karen, Nairobi.
Okay.
Yeah.
Thank you. Thank you, Daktari. We're grateful. We've learned a lot. Looking forward to doing this again as the Lord enables us to do that. So thank you, dear viewer, for joining us on Health Check this day. And I hope you've learned a thing or two. If you're watching us and you know some of the symptoms Dr. Malaika has mentioned, you have them, please reach out. Reach out. There is help for you. And if you have a loved one, it could be a friend, it could be your child, or a loved one and has any of these symptoms, please also reach out. There is help for you. My name is Grace Mutisa. I wish you a blessed time. God willing, let's do this again next week as we bring you another different expert talking, of course, on a different topic. And remember, our repeat of this program is tomorrow. Yeah, tomorrow around 11. Yes, my producer says around 11, 10 or 11 there. Have a beautiful evening, God willing. Let's do this again next week on Tuesday. And remember to share this link with a loved one. You can find it at Hope TV Kenya. Bye-bye.